So if you compare to data before Sectra was and the AI was being introduced in our pathway, we are treating 4 times more patients. Stroke is one of the leading causes of death and disability in the UK. Every 5 minutes, one person suffers from stroke in the UK. And for every minute of that stroke, that person loses 1.9 million neurons. So you have to act quickly to get a best outcome for the patient. When patients come to the hospital, they have a scan. Now, Sectra has got uniquely integrated AI features in it, an AI program through which you can get rapid diagnosis for the stroke patients, looking at how much of the brain is impacted and how much of the brain is actually salvageable. And based on that, we can rapidly progress these patients to therapy, to treatment, which is thrombectomy, removing the thrombus from the brain. Now, based on the information we get from the imaging, we can make decisions quickly and faster, and more patients can benefit from this treatment. Thrombectomy saves brains. In a way, it changes lives, also saves lives at the same time. Now, previously patients with stroke with no thrombectomy would have either 2 outcomes: either they would be dead or severely disabled because of the impacted by a large stroke. Now patients are going home as early as the very next day. And previously, before the treatment was introduced, these patients would end up in a nursing home. Now these patients are going to their own homes. And from the cost effectiveness, if you look at the savings brain document from Stroke Association, thrombectomy can potentially save 1.3 billion to the NHS over 5 years' time. Now, there are a number of advantages through which the Sectra helps. One, we can rapidly treat those patients and get a good outcome for them. Previously, only 3.3% of the eligible patients were benefiting from thrombectomy. That's even now nationally, but in our hospital, all the eligible patients, that's 10% of all stroke patients, are benefiting from thrombectomy. That's 100% outreach for all these patients. So all these changes are possible because of this rapid imaging, which is provided by Sectra, and also its integration with the AI. Okay. As a neuroradiologist, Sectra PACS has been very useful for diagnosing a number of neurological conditions, from stroke, dementia, tumors, and also spinal conditions, and a range of other neurological conditions. But the number one focus for me is driving innovation, and we have been driving innovation through the use of AI and integrating it with Sectra for thrombectomy purposes. And that's been the number one focus, through which we have saved numerous lives and also increased our patient population for treatment.